Good evening and welcome to our COVID-19 update program. I am Ladi Akiridoluale. Here are the highlights at this hour. Presidential Task Force on COVID-19 promises some financial support to Ogun State, commends its prompt response to prevent the spread of the virus. Channels Television exclusive, we visit the Muhammadu Buhari COVID-19 Isolation Center in Kano. South African court gives government 14 days to bring restriction guidelines in line with constitutional provisions. We begin tonight in the United States, where the three other police officers who assisted in restraining George Floyd, the 46-year-old African-American who died last week, will now be charged with aiding and abetting murder by the Minneapolis Attorney General. Policeman Derek Chauvin, who had his knee pressed on Mr. Floyd's neck, has already been charged with third-degree murder and second-degree manslaughter. His charges are expected to be upgraded to second-degree murder. The lawyer representing George Floyd's family has welcomed the expected decision, stressing that this is a bittersweet moment for the family. Earlier today, he had joined Floyd's son, Quincy Mason Floyd, at the scene of his father's death in Minneapolis. He says an independent inquiry into the murder of Mr. Floyd revealed that he was tortured to death. Quincy Floyd told reporters at the scene that he's trying to get justice for his father and thanked everyone for the show of love and support. Let's get the very latest from our correspondent in Washington, D.C., Maria Bird. Good evening, Maria. What is the very latest on this matter? The charges have not really been formalized yet, have they?
Yes, well, we do know just moments ago it was released that they have upgraded Chauvin's charges to second-degree murder. And so Keith Ellison, the Attorney General in Minnesota, has been working very hard, and he has actually been a long-standing civil rights advocate for civil rights. And so I think many people were hopeful that he moved very expeditiously in the process, and says that there's still more investigation to be done because the family is obviously calling for charges to be first-degree murder. And as you mentioned, the aiding and abetting for second-degree murder are for the other three officers that were there. And those charges too could change depending on what further investigation shows. But I think many in Minneapolis and all across the country and the world, to be honest, are happy to see that some form of justice is being brought forth.
Very emotional moments and very emotionally tied decisions being made here. Mr. Floyd's son visited the site of that gory scene that the world saw on various platforms today. What was the immediate reaction to that site?
Breaking down. I mean, you can see the pain and the anguish that this young man is under at this time. And watching the whole world use your father as a way to move justice forward when you're dealing with great pain. And so I think all of those that were there during that time saw that this is not just about our larger movement, but this is a person that has lost someone so dear to them that, as many have said, was a gentle giant.
Finally, Maria, before we let you go, the demonstrations have gone global. More and more countries and more cities are joining in, the UK, Europe itself, and a number of others. Now, this is putting some level of not altogether positive light on America on the global scene. What's been the reaction to that within America?
Yes, America is, obviously very much, having racism has touted the history and the legacy of the United States for so long. But we know that many Americans are happy to see their brothers and sisters across the globe advocating and standing up for what many have seen as devastation in the U.S. and purely injustice against African Americans and people of color for many, many years. I mean, this goes back, as people say, 1619. We're talking about when slavery began. And so we're looking now, and people are saying we're not just satisfied with the charges being brought forth. We want to see systematic changes in the policing and the structure of policing in the United States. And so many police chiefs are answering the call and are looking to see how the culture of policing in the US can change.
Thank you very much, Maria Bird, our correspondent reporting from Washington, D.C. And please do stay safe out there. Thank you so much.
Thank you.
Let's come to COVID-19, and we start off in Ogun State, where the Presidential Task Force has commended the state government for the purposeful leadership it has brought to bear on the response and management of the coronavirus pandemic since its outbreak in February. This commendation is coming from the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib, when he paid a courtesy call on the state governor, Mr. Dapo Abiodun, in his office in the state capital. While reiterating the commitment of his administration towards qualitative health care, Governor Abiodun, however, asked for more assistance from the federal government.
We want to leave this place with a clear message to all citizens of Ogun that the Presidential Task Force is happy with the response of Ogun State to the outbreak, to the COVID-19 outbreak, and that the federal government will be supporting Ogun State with funding, because Ogun State took on the burden of addressing this outbreak right from when it started in February. We know some of the steps that Ogun State took, and because of those steps, we've seen an outbreak that is not as huge as if that initial responses were not well done. So we want to thank Ogun State on behalf of all Nigerians for the leadership that was shown from the early days. And some of the expenditure that Ogun State has borne clearly has to go into some of the allocations that the federal government, the Presidential Task Force, is looking at giving Ogun State and other states.
We understand that some support is on the way. It is far short of our expectation. We are very appreciative of it anyway. We are going to accept it as an installment, that will just be part installment of the total that they're going to give us, because it's heartwarming to hear from you. It's heartwarming to know that our efforts have been appreciated in the right quarters, because if somebody in the private sector said what you said, it may not resonate as much. But when the health professionals who are charged with the responsibility of providing oversight to what we are doing say this, it's only heartwarming, it's very encouraging.
Meanwhile, in Ekiti State, breaches of the interstate travel ban and its resultant effects have become a major concern as the state records 5 new cases of COVID-19, the highest to be declared at once. The state COVID-19 task force has consequently warned that the interstate travel ban subsists in the state and calling for more responsiveness and vigilance on the part of security operatives and citizens. The recent cases are nurses and hospital patients infected through contact with the 75-year-old woman who recently died at the Ekiti Federal Teaching Hospital after being referred from Kwara State. The state governor, Dr. Kayode Fayemi, had on Sunday announced the relaxation of the lockdown in the state, and on Monday commissioned a molecular laboratory for sample testing within the state.
The 3 patients that are currently infected, they have comorbidities. When we say comorbidities, they have other medical conditions that are, moderate to severe. And because of this, we are keeping those 3 in the federal institution where they are. They will be transferred to isolation. They will be taken care there. We are going to check on every other person that have been in contact with them, and that's the way we will deal with that. The 2 healthcare workers, they are asymptomatic at this point. One thing I would like to stress, especially for our communities and our security workers, we cannot continue to allow people to come into this state. There is still interstate lockdown. Because there is an interstate lockdown, we see what we are getting every time we allow people We don't know whether those people coming in, it's not everybody that comes in will come to be COVID-19 positive. But every time one person turns COVID-19 positive out of the people that sneaked into Ekiti State because they are not supposed to come here legally, this is what we face.
On a happier note, about 20 COVID-19 patients have been discharged from 3 isolation centers in Lagos. The discharged patients, 14 males and 6 females, all Nigerians, were discharged from the Bagada, Etiosa, and Agidingbi isolation facilities to reunite with the society. Having fully recovered and tested negative to COVID-19, 11 of the patients were discharged from Bagada, 8 from Etiosa, and 1 from the Agidingbi isolation centers. With this, the number of COVID-19 confirmed cases that have been successfully managed and discharged in Lagos is now 928. And speaking of isolation centers, for those who still doubt the existence of COVID-19, the pictures you are about to see may clear that doubt. Our correspondent Idris Jibrin in Kano, donning his full protective personal suit, visited the Muhammadu Buhari Isolation Center, where some of the COVID-19 patients are currently being treated. Kano is number 2 on the list in Nigeria after Lagos State in terms of the highest number of cases.
Since the first index case of COVID-19 in Kano was identified and the subsequent response by the state's government, some people in the state still don't believe the reality of the virus. Now, Channels Television has been allowed access to Muhammadu Buhari Isolation Center in Giginyu, and who you can see here are positive patients of COVID-19 who are receiving treatment in this isolation center. As at today, Kano State has tested over 4,000 samples. 970 are confirmed positive. 639 are active. 45 deaths recorded, while 286 patients have been discharged from various isolation centers across the state, including this one. Although the recent mysterious death recorded in the state is still unclear on whether it's COVID-19 related, but authorities confirm that investigation is still ongoing to know the real cause behind the mass death. Therefore, if you are still contemplating about the reality of COVID-19, these patients must have helped clear your doubts. From Muhammadu Buhari Isolation Center in Kano, Idris Jibrin, Channels Television News.
Markets are struggling to keep to rules on social distancing, wearing of face masks and providing other paraphernalia necessary to ensure people do not get infected with COVID-19 when they come to the markets. At the Garki International Market in Abuja, while many provision stores are providing hand sanitizers and hand washing spots, at the food market, many customers and vendors are not wearing face masks or observing social distancing.
Not all markets in the nation's capital open at the same time, and the ones that are open have to close at 3 p.m. The Garki International Market is open today and is one of the most organized markets in Abuja. Patrons must wash their hands at the entrance to the market, and anyone with a temperature of over 39 degrees or not wearing a face mask is not allowed into the market. We see hand-washing spots in front of some shops, and the storekeepers show us the hand sanitizers for customer use. However, things are quite different at the food section of the market. Many patrons and vendors are not wearing face masks or observing social distancing.
Why you don't want to wear them though? Why do you use face mask? They not face mask again now. You wear face mask.
Some put on their mask when they spot our cameras. The inconvenience of wearing a face mask is a sacrifice we all have to make to protect ourselves and others from COVID-19. The fear is With the eased lockdown, many may have become complacent, forgetting that while we enjoy our liberties, we're still dealing with a deadly pandemic, with constantly rising figures of infections and deaths in Nigeria.
Meanwhile, traders in Imo State have been reacting to the ease of lockdown guidelines and possibilities of compliance. Our correspondent, Itokwe Kutei, went round and brought back this update.
Is the popular Ekuku market along Douglas Road in Owerri, and obviously there is total disregard to the basic precautionary measures like physical or social distancing, use of hand sanitizers and face masks, and there is no definite point to wash hands with soap. Some of the traders we spoke to share their opinion on this.
I don't have face mask. There's nothing like cholera in this country. I think it's causing me heat. That's why, that's it. And it means I don't breathe well.
On the part of the government, they're stepping up actions by coming up with more enlightenment and sensitization program, as well as provision and distribution of basic PPEs to prevent community transmission and also contain the spread of the coronavirus disease in Imo State.
We distributed face masks, sanitizers, even infrared thermometers, and most importantly, different assorted types of education and information materials.
We'll continue to bring you up to speed with events and happenings around here as it concerns the COVID-19 pandemic. From Owerri, the Imo State capital, Itokwe Kutei for COVID-19 updates.
Thank you very much, Itokwe. We'll take a break, and when we come back, we'll be taking a look at the very latest figures and what the implications of some of these breaches of the protocol guidelines with regards to markets could be. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Let's take a quick look at the COVID-19 figures in Nigeria coming out from the Nigeria Center for Disease Control, the NCDC, in the last 24 hours. Total confirmed cases in the country stand at 10,819. Of this, the active cases being managed across isolation centers is 7,266, while 3,239 patients have recovered from the virus, but the death toll is also now at 314. Looking at the figures by region, Lagos in the southwest still has the highest number of cases at 5,277. Next is Kano in the northwest with 970 cases. The FCT, that's the Federal Capital Territory, Abuja in the north-central region, maintains the third highest figure in the country with 687. In the northeast, Borno tops the list with 296 cases. Edo in the south-south has 336 cases, while Ebonyi leads in the southeast with 40 cases. We're still taking a look at the situation in markets, this time in Edo State, where, as you've just heard, it retains the highest number of COVID-19 cases in the south-south region. But in spite of this record, traders in some of the markets say they are eager to return to their regular marketplaces. During a visit to some of the relocated markets in the state, Channels Television observed that most of the traders who are already back to their trading activities are not adhering to NCDC protocols on COVID-19, while some go further and insist the virus doesn't exist.
The directive for the relocation of all markets in Edo State to the nearest primary schools was to ensure compliance with the protocols set by the NCDC on how to prevent the spread of COVID-19. Compulsory use of face masks and washing of hands with soap under running water are some of the NCDC guidelines which the state government emphasized as it gave the directive. About 2 months after the directives were made, the number of confirmed cases of the COVID-19 in the state has more than tripled, but the traders are yearning to return to their original marketplaces.
Even if you put face mask here, this odor, this smell, you go see the yara. So even if a virus won't affect us, you go see affect. So what is the need of putting it?
See this environment where the carry us come, so he even passed coronavirus disease. Yesterday, if you see this place, it be like River Niger. If you see earthworm, when our leg carry low, it passed coronavirus.
At the markets relocated to Army Day School in Ikuba Hill, Benin City, while social distancing is largely being observed, some buyers ignore the hand-washing rule. At Payne Primary School in Uedo local government area, one of the market coordinators, Lucky Orukwe, says there are still some challenges that the traders deal with.
They are also doing screening for our traders, whereby the customer that come to buy something in the market. So I think that when we come together to share common idea, we can deal with this COVID-19.
With the current rising figures of COVID-19 in Edo State, amid these steps taken, the government believes that there is serious community transmission of the virus and has pledged to take more decisive actions in the coming days.
Managed access to markets and locations of economic activity is one of the non-pharmaceutical interventions rolled out by the federal government nationwide to limit the risk of COVID-19 transmission. But there have been concerns around its implementation and the public health implications of the non-adherence to these measures. Taking markets, for example. Joining us via Skype from the Amuwo-Dofi area of Lagos is a consultant public health physician, Dr. Modupe Akinyinka. Dr. Akinyinka, thank you for your patience and welcome to the program this evening. It's a pleasure to have you with us.
Good evening. Thank you for having me.
In spite of the fact that in 2 days, it will be 14 weeks since the index case of COVID-19 in Nigeria was diagnosed, from some of the reports there from some of the states, you still have people saying that there's nothing called coronavirus, there's nothing like COVID-19, and they will not, as a result, be taking measures to protect themselves or others. These are at markets where a lot of people go.
Yes, it's a real pity that we have that happening right now, that people, even after 3 months in Nigeria, having cases, and then with the heightened number of cases that we have, having people still disbelieving that there's no coronavirus, then it's a real problem, and we need to sort that out. We need to engage with people at the community level, at their different levels of the community. We need to engage with them so that people can understand that this thing is something that is actually with us right now. And it's not just here, it's also in other parts of the world. If they listen to news, they would see that Nigeria is not the only country that is affected by this. And so we need to be able to communicate that fact to our people by engaging them from the grassroots, you know, from the leaders of the people, the people that the community gatekeepers, people that people respect within the community, then the heads of the groups, for example, the market heads, you know, the heads of the different associations in those places, like maybe sellers of computers and all of those, you know, those groups that they have, because they all have groups, Okada rider groups, their heads, you know, the different community groups, the heads of these groups, so that we can communicate this risk to them, so they can understand that this thing is something that is really done. The fact that we can see people going to isolation centers, you know, being treated and then coming out of those isolation centers. So people need to know and believe that it is real so that they can protect themselves.
There's a problem with the structure of most markets in Nigeria. First of all, many of them are open and they're not constructed, so to speak, in such a way as to make it possible for you to separate one trader by 2 meters and so on, the kind of things that are now necessary to ensure that COVID-19 doesn't spread using those markets. Given that as the background, what really can be done now to mitigate the circumstances we find ourselves? One of those who responded in one of the reports there talked about the fact that because it's open air, is wherever you find space that you can put your wares and sell.
Yes, many of our markets are open air, and that would be an advantage, being open air, because at least you're sure that there's air blowing, and then the risk, you know, of getting it may not be as much as if they were in enclosed spaces. But now, the closeness, the proximity of the people in the market is now the issue. So each person would have to take that responsibility for themselves and be able to ensure that once I'm here, then I shouldn't have somebody that is too close to me. If that person is not a member of my family, we're not living in the same house, right? And if customers come, it's not until my nose is almost touching the customer before I can attend to that customer, right? I wear my own mask, and then the customer also wears his or her own mask. And then, so it's something that it has to be that we take personal responsibility. So each person has to take personal responsibility, because there is so much that government can do. You know, they can't now start to rebuild all the markets. So those markets whereby they are so close, now they don't need to have all the people that they usually have there. So the minimum number of people to be able to attend to customers adequately, and then ensuring that they are maintaining that physical distance to protect themselves. Because if we don't do this and people don't take responsibility like this, then we're going to have, you know, a huge increase in the number of cases. Because many of these people that are in the markets and then that also visit the markets, once they come to those markets, they may get infected if they do not practice, you know, all of this. They don't put into place all these strategies and are making use of them. They're not wearing their face masks. They're not washing their hands. They are being too close to people. All right. So if they get infected, fine. They may be part of that 80% of the cases that will be asymptomatic, but then they will go home, and in their houses, they will have people that are vulnerable, and these vulnerable people will get infected. And once they get infected, then we have, you know, that increased number of people that need isolation centers for treatment. And of course, once we start having that, then we're going to be having more deaths. And we shouldn't.
Thank you very. I'm sorry, Dr. Akinyika, I'm sorry. I have to cut you in because we've completely run out of time. But I believe that you have made the point, and we will return to the issue of markets when the various state governments have come out with their own specific guidelines for the markets, and I'm sure we will be speaking with you on that and how to proceed from there. Dr. Modukpe Akinyika is a consultant public health physician, and she joined us today from Amuwodofi in Lagos. Thank you so much for your time tonight.
Thank you very much for having me on the program. It was a pleasure. Thank you.
Staying on the issue of markets, but this time let's go to the south, to another south state, this time in Bayelsa, where our correspondent, Deborah Timiwood, has the update.
This is Swali Market, which is a major market in Bayelsa State. The gates are locked now because it is past trading hours. Earlier on in the day, we visited the market and immediately noticed that social distancing was not being observed. Interestingly, a couple of weeks ago, when Bayelsa had its index case for the coronavirus, at that time, it was compulsory for anyone that wants to gain entry into the market to first wash their hands here. Now, there was a bucket of water and sanitizer. You'd wash your hands first before you gain access into the market. But today, it was visibly absent. We spoke with the government's representative at the market and the head of the market union. And here's what they had to say.
Normally, before this time, we have some vigilante officers that we are taking control of those people washing hands before they came into the market. But later on, we are not seeing them working again, and we don't know what is happening.
That rowdiness is not caused by the traders, but they are buyers that are coming through the gate that you see that they are somehow rowdy. But on the side of the stores that we do even sales, we maintain that order. The social distance is there.
This wasn't the only market we visited today. We also visited the Opolo market and Okaka market in the Yenegua metropolis. We also observed same trend of rowdiness and low usage of the face masks at the various markets visited. From Yenegua, Deborah Timiwood for COVID-19 updates.
Thank you very much, Dobra. Another public health physician who has interest in health systems strengthening and public health advocacy joins us now from Mende in Maryland, Lagos, Dr. Chidimga Ohazurike. Thank you so much for your time. Welcome to the program. Markets are likely to become an area of some significant challenge in the days ahead in preventing the spread of COVID-19. From everything we're hearing, it doesn't appear as if much of the awareness about this has percolated down to our local markets in particular.
Yes, good evening, Ladi, and thank you for having me. I think that's a very important question and one that is very troubling even at this time, because we can see there's almost non-compliance across all markets. When you look at the compliance to the non-pharmaceutical interventions for the prevention for the spread of COVID. And for where we are now, where we already have widespread community transmission, that means that the days ahead are going to be not things to look out for. Because for COVID-19, your behavior today can only be seen in the next 2 weeks. So when people don't understand that what they do today, the effect of it can only be seen in the next 2 weeks. That's quite troubling for the people who are in control or who are in charge of controlling this pandemic. And that's why we say that we need to do a lot more risk communication by engaging the sellers in the market, the associations, the heads of the associations, for them to understand that COVID-19 is real and the risk for contracting the disease is real for every one of them.
The structure, because now this is a reality, so we're going to have to deal with this. You've talked about engaging with the traders and so on, but the structure, as I asked the previous speaker, who is another public health physician, as I asked, the structure of our open and local markets also makes things like social distancing particularly quite difficult. And so how does one resolve that?
Okay, for me, I'll be looking at allotting plots, so just like drawing things on the ground of the market to show that, okay, this is 2 meters from one person to the another, so that people know that they're supposed to sell their wares within those confined plots. So while we have open markets, and that is what we have now, we can actually have like designated plots where each seller can have that maintains that 2 meter distance between one seller and another seller. I think those are some of the things that we can consider and we can quickly do, just drop plots that can keep one seller from the other person 2 meters apart.
How about the issue of face masks, though? Because that's something else that isn't being complied with, face masks.
Yes, that's where risk communication comes in, because I think that the low level of compliance with face masks is because people don't even know how it works. In your report, you could hear the excuses, it's too hot, the environment is already full of foul smell, and you expect me to wear this, and then the weather conditions is making the place flooded. Soil helminths are greater than the risk of coronavirus. It shows that people don't even understand how this is transmitted and why they're supposed to wear the face mask. I think our risk communication and our community engagement should come to people understanding how this is transmitted and how face masks will help them to stop the spread of the disease, both for themselves and from the person who is coming to buy from them.
Thank you very much, Dr. Chidimga Ohazurike, for your time. Well, of course, as I said before, this issue will continue to rear its head over and over again in time to come. Thank you for joining us tonight.
Thank you, Ladi, for having me.
Beyond Nigeria, in South Africa, the Pretoria High Court has declared the regulations promulgated for COVID-19 lockdown levels 4 and 3 as unconstitutional and invalid. The regulations are set by the Minister of Cooperative Governance and Traditional Affairs, Nkosazana Dlamini Zuma, were challenged by a Reno David De Beer and a voluntary group who argued that they encroached on and limited their rights as contained in the Bill of Rights in the Constitution. The court found that the lockdown regulations indeed did not satisfy the rationality test and were not justifiable in an open and democratic society, based on human dignity, equality, and freedom. The court also noted that the role and existence of the National COVID Command Council did not feature in the application. The declaration of invalidity is, however, suspended as the minister has been given 14 days to consult with other cabinet members and fix the deficiencies in the regulations. For the update on other things happening, including our market issue, here's our Bureau Chief, Betty Divya.
At the shopping malls across South Africa is mostly a tidy picture of queues, hand sanitizing, and limited number of mask-wearing shoppers at a time to maintain physical distancing as well as other anti-COVID precautions.
In South Africa, you don't exactly have open markets like you have in most parts of Nigeria. Here you have a mixture of shops, covered markets, as well as a string of street vendors. We're here at the Yeoville market in Johannesburg, where, as you can see, you have the application of physical distancing as well as the use of masks. It's quite arbitrary.
We tried to film inside the covered part of the market, which was relatively more orderly, but we were not permitted. But on the streets, it's a tough task for the official patrollers to get the many street vendors to comply with directives.
Yeah, we are wearing masks, but we tell them they must make a social distance, but they don't do it. As now we are chasing them, they've got no right to selling here on the street. They refuse to go.
In South Africa, meat is sold at the butcheries. While the authorities have happened upon unwholesome meat products, as seen here, most butcheries try their bit to comply with set rules for operation.
Okay, the social distancing is a bit difficult, but we try, like Basil will try and, control it from outside. And, but we come 1-1. Yeah, they come 1-1 if it's too much. We've got markers there, for the customers, and that's how we control our social distancing.
While efforts at maintaining the required health and safety standard of food products and health safety of consumers by service providers can be seen, more responsibility on the part of consumers to comply is also expected. From Johannesburg, South Africa, Betty Divya, Channels Television News.
We'll take another break at this point. When we come back, more countries in Europe and around the world continue to ease lockdown restrictions. Please stay on with us. Thanks for staying tuned. More countries in Europe and around the world have continued to ease lockdown restrictions and may soon allow for international flights. Borders have also been reopening as global infection rates continue to rise as well.
Children in North Korea have returned to school wearing protective face masks 2 months after the new term was due to get underway. While North Korea has not reported any cases of the coronavirus, which emerged in China late last year, South Korea's main intelligence agency has said an outbreak there could not be ruled out as the North had exchanges of people with China before closing the border in late January. And over in Israel, according to official figures, almost 7,000 students and teaching staff are now in quarantine, and more than 40 schools are closed because of outbreaks of COVID-19. Despite this, the government has decided that, in general, schools and kindergartens should stay open for now. In Italy, it's been an emotional day for families reunited after 3 months of lockdown separation. The country has reopened its borders and ended travel restrictions between regions, hoping to encourage tourists back in time for the summer. Meanwhile, the Italian Foreign Ministry says it has not held conversations at this point with the UK about the possibility of establishing air bridges between the two countries, which would mean British tourists don't have to self-isolate after visiting Italy. In other developments, Austria says it will end coronavirus-related border and health checks on Thursday for all countries except for Italy. Visitors from the other 7 bordering countries will not face quarantine measures. And elsewhere in Europe, Germany says it will lift a travel ban for European Union member states plus Britain from June the 15th, as long as there are no entry bans or large-scale lockdowns in those countries. The country says it will also remove its general warning against travel to European countries. However, it will continue to advise against travel to Britain for as long as the UK government continues to demand a 14-day quarantine for new arrivals.
From the World Health Organization, that's the WHO, physical distancing is said to be one of the most effective methods of limiting the spread of COVID-19. You can find more information on how to protect you and your loved ones from the website of the World Health Organization. On the other hand, the NCDC, that's the Nigeria Center for Disease Control, has the latest in the figures of confirmed cases, active cases, discharged, and deaths about COVID-19 throughout Nigeria. Our website, channelstv.com, also has the latest on all the news, particularly and including a news of COVID-19. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world, all at your fingertips. Thank you for watching tonight, our COVID-19 update. I am Ladi Akiriduluale. Good night.